Hi, my name is Cherie. I'm the student and today I will be demonstrating Assessment 1 of Practical 4, which is Counselling Therapies 1. This assessment is a formal discussion including 3 separate case studies. So let's get started. Case study number 1, Wade, aged 47. The client's presenting concerns and issues are: Wade is still grieving the loss of his relationship with his girlfriend of 12 years. It's been 3 years since the separation and he hasn't been able to move on. Wade has recently met another woman, Tracy. He would like to give her a chance, but is still living in a fantasy world and keeps comparing her to his ex. The client's needs are: Wade needs to accept the separation of him and his ex and accept that his ex has moved on. Wade needs to deal with the feelings of grief and loss regarding this past relationship. Counselling goals for this client may include: Wade will learn coping skills, relationship skills, skills to deal with any unfinished business, and emotional regulation. This will be measured by him demonstrating these skills during therapy sessions and bringing in homework assignments for 2 consecutive weeks that show he practiced them in between sessions. I believe Wade will be responsive to counselling. He has come out of his own will, acknowledges his fantasies, and wants help so that he can move on. Considering Wade's responsiveness to change, presenting goals and likely goals, a person-centred approach would benefit Wade because it allows him to set his own goals and monitor his own progress towards these goals. This approach places emphasis on the here and now of Wade's existence, both inside and outside of the counselling relationship. This emphasis replaces diagnosis in counselling, which is considered undesirable. This approach will help Wade learn self-reliance. This type of therapy emphasises reflective listening. If Wade feels he is being heard without being judged or evaluated, he is more likely to express deeper feelings, leading to self-exploration and self-understanding of attitudes, beliefs, and feelings. The limitations of using a person-centred approach with Wade are: if the counsellor oversimplifies the major concepts of the theory and limit their own repertoire or responses to reflections and empathic listening, then, as a result, they often fail to distinguish between the use of their own personality, their self as instrument. If Wade is unaware of any positive effects resulting from his interaction with the counsellor, then he may withdraw from the counselling process altogether. A Gestalt approach would benefit Wade because it explores processes that operate in the background of unfinished business. Unfinished business include emotions and memories surrounding past experiences that a person has avoided or repressed. The feelings around the event are not fully processed at the time, often because if they are too overwhelming or they're too traumatic. This type of therapy is suitable for patients who are willing to have their behaviour changed through working on personal experience, reflecting on their self-picture, experimenting with anything new, and or learning to be in authentic contact with the therapist. Since Wade has attended counselling voluntarily, and looking at the case study notes, I assume he is open to all of this. The limitations of using a Gestalt approach with Wade are: there are a wide range of interventions and therapeutic styles used in this approach. Without therapist sensitivity, these activities can lead to Wade feeling overwhelmed, intruded upon, in danger, used, seduced, or shamed, etc. Therapists with a weak professional background or who are poorly trained in this approach would pose a danger that techniques and emotional involvement will proceed without clarity about goals, what is central to the client, alternative methods, and so on. The techniques and/or processes I think would be most beneficial to Wade are: the Gestalt approach of focusing on the here and now. This is because focusing on the past and the future can be a way to avoid coming to terms with the present, and power is in the present. It is common tendency for clients to invest their energies in expressing discontent about their past mistakes and contemplate on how life could and should have been different, or engaging in endless resolutions and plans for the future. For example, Wade imagining his ex will come knock on his door in the future. As clients direct their energy toward what was or what might have been, or live in fantasy about the future, which Wade acknowledges he does, then the power of the present diminishes. The experiential technique I believe that is appropriate to use with Wade is the exaggeration exercise. This is because I believe Wade is experiencing unfinished business. The effects of unfinished business often show up in some blockage within the body. Gestalt therapists emphasize paying attention to the bodily experience on the assumption that if feelings are unexpressed, they tend to result in some physical sensations or problems. Therefore, the exaggeration exercise is when the client is asked to exaggerate the movement or gesture repeatedly, which usually intensifies the feeling attached to the behaviour and makes the inner meaning clearer. This can include a slouched posture, bent shoulders, clenched fists, tight frowning, facial grimacing, crossed arms, and so forth. The technique and/or process I would be most comfortable using with this client is focusing on the here and now. I would help Wade make contact with the present moment by asking what and how questions. For example, I could ask, what is happening now? Or what are you experiencing as you sit there and attempt to talk, and so on. I recognise that the past will make regular appearances in the present moment. If Wade goes back to the past, I may ask him to reenact it as though he was living in it now. I can do this by directing Wade to bring the fantasy here. Case study number 2. Pamela, aged 20. The client's presenting concerns and issues are: Pamela may have an alcohol addiction problem. She acknowledges she started borrowing money to pay for her alcohol-fueled nights out, and it got out of control. Pamela is experiencing financial hardship, is in debt, and owes people money. Due to her situation, Pamela is considering doing exotic dancing to raise quick money, but feels uneasy about the idea. The client's needs are: Pamela needs to deal with her alcohol addiction problem. Pamela needs to raise funds to pay back the debt she owes. Pamela needs to explore other alternative ways of making money, so she doesn't feel exotic dancing is her only option, and from there she can make a more informed decision. Counselling goals for this client may include: Pamela will explore her alcohol addiction and learn new coping skills. Pamela will explore 3 alternative ways of raising funds, which will give her more clarity on what her best option is. Pamela will explore her debt and gain more insight and understanding of her financial situation. I believe Pamela may not be responsive to counselling. This is because even though it appears she has come to counselling out of her own will, there's a good chance she may not have, due to her financial situation, as it's not clear how she is paying for these sessions. Also, it states she's come to therapy to gain clarity about whether or not she should do exotic dancing. However, I believe there's an even bigger problem she is not acknowledging, which is having an alcohol addiction. If she doesn't see this as a problem, and it turns out to be it is, she could possibly withdraw from the counselling process altogether. Considering all the factors just mentioned, a person-centred approach would benefit Pamela because the approach's emphasis is on providing the client with the kind of facilitative environment in which the focus is fully on their concerns. As a result, Pamela will sense that she is being listened to, as she receives responses from the therapist that involve feedback on what she has said. In this example, considering Pamela is a young university student, I think it's important she feels she is being listened to and treated like a respectful adult, which can make her own decisions. Which brings me to my next point. Person-centred counsellors consciously avoid taking responsibilities for decision-making by clients, leaving that responsibility with the client and thus helping them recognise their own power over themselves. In this case, Pamela doesn't need someone telling her exotic dancing is not a good idea. She does, however, need guidance in making her own decisions. The limitations of using a person-centered approach with Pamela are: person-centered therapy appears to be less effective with persons who do not voluntarily seek counselling. The case study notes don't specifically specify that Pamela sought counselling out of her own will. Considering she is a young student in debt, it's likely her attending counselling wasn't voluntary. Person-centered therapy also appears to be less effective with people who have limited contact with reality. In this example, it appears that Pamela may have an alcohol addiction problem, but she doesn't seem to think she has a problem and therefore may not be in touch with reality. A Gestalt approach would benefit Pamela by restoring and/or establishing awareness process that leads to insight. If Pamela's therapist is self-aware and able to be transparent, undefensive, authentic and congruent, then the therapy is enhanced and there is much more likely chance of success. The limitations of using a Gestalt approach with Pamela are: if the chemistry between Pamela and the therapist suggests that a better therapeutic relationship could develop with a different therapist, then this type of therapy will not work. If Pamela doesn't acknowledge the need for therapy or has the motivation to do the work of therapy, along with the intelligence, education, and financial support for carrying through on therapy, then this type of therapy won't be effective. The techniques and/or processes I think would be most beneficial to Pamela is not actually a specific technique. It is a skill used in person-centered therapy. This skill is being empathic, which is an active, immediate, continuous process where the therapist strives to sense the client's subjective experience, particularly in the here and now. The aim of being empathic is to encourage clients to get closer to themselves, to feel more deeply and intensely, and to recognise and resolve the incongruity that exists within them. Empathic understanding implies that the therapist will sense clients' feelings as if they were his or her own, without becoming lost in those feelings. Therefore, empathy will help Pamela to pay attention and value her experiences, see earlier experiences in new ways, modify her perceptions of herself, others, and the world, and increase her confidence in making choices and in pursuing a course of action. The technique and/or process that I would be most comfortable using with Pamela, again, is not a specific technique, but rather a skill used in person-centered therapy. This skill is displaying unconditional positive regard, which is when the therapist is experiencing a positive, non-judgmental, acceptant attitude toward whatever the client is at the moment. It involves the therapist's willingness for the client to be whatever immediate feeling is going on. When the therapist prizes the client in a total rather than a conditional way, forward movement is likely. Case study number 3. Gareth, age 42. The client's presenting concerns and issues are: Gareth is concerned his ex-wife is making up stories about him to their children. Gareth is concerned that when he moves back to his hometown, that he won't have a close relationship with his 2 daughters, like the one he had when he lived interstate. The client's needs are: Gareth needs to explore and find out the reasons why the relationship between him and his 2 daughters have changed since his announcement. Gareth needs to deal with the anxiety he feels about moving back to his hometown. Counselling goals for this client can include: Gareth will learn new coping skills and relationship skills. Gareth will gain insight and clarity into why the relationship with his 2 daughters have changed since the announcement. I believe Gareth will be responsive to counselling. He has come to counselling out of his own will and wants help to assist him in dealing with the situation he finds himself in. Considering all the factors just mentioned, a person-centred approach would benefit Gareth because person-centred concepts are applicable to a wide variety of helping situations, as well as to daily living itself. So if this therapy is successful, Gareth will be able to apply these concepts to other areas of his life. Person-centred therapists attempt to help the client develop insight, which is one of Gareth's main goals. The person-centred approach is built on trust that individuals can set their own goals and monitor their progress towards these goals. Therefore, even once therapy is completed, Gareth, like previously mentioned, can take these learnings and apply them to other areas in his life. Gareth also appears to be anxious about the move back to his hometown, which is important because for counselling to be successful, Gareth needs to experience some kind of anxiety and be uncomfortable enough to want to change. The limitations of using a person-centred approach with Gareth are: if the counsellor doesn't experience empathic understanding of the client's world and then communicate genuine acceptance of the client's feelings about the world, then the client may not experience self-acceptance, which is needed in this type of therapy. Gareth must perceive, at least to a minimum degree, the counsellor's unconditional positive regard and empathic understanding, otherwise the therapy will not be effective. A Gestalt approach would benefit Gareth by teaching him through interventions to actively engage in sensing, experimenting and self-discovery. Therefore, Gareth will learn to look, hear, sense, imagine, discover what is important, true and possible for him. He will also be encouraged and guided in experimenting with new behaviours for the purpose of gaining a better understanding. The more strength and support Gareth brings to the therapy, the more likely successful it will be. I believe Gareth will bring this because he has the motivation to fix the relationship with his two daughters. The limitations of using a Gestalt approach with Gareth are: if the therapist is not clear in defining the therapeutic framework, firm about professional boundaries, and sensitive to Gareth's experience, then it will not be safe or effective practice to use this type of therapy. The therapist must get his or her own confirmation from sources other than Gareth if the therapist is not to subtly convert therapy into a process of therapist confirmation, which in this case could be difficult. The techniques and/or processes I would believe would be most beneficial to Gareth are: in Gestalt therapy, the empty chair technique. This is a method of facilitating the role-taking dialogue between the patient and another person, in this case Gareth's ex-wife. As Gareth alternates the roles, he will sit in one or the other chair. In this process, emotions and conflicts are evoked, impasses may be brought about and resolved, and awareness and integration of polarities may develop. The technique and or process that I would be most comfortable using with Gareth is the top dog underdog dialogue. This is when the patient is asked to experiment by taking each part of the conflict in turn by means of dialogue. The most common split is between two aspects of the personality that can be referred to as the top dog and the underdog. The top dog is righteous, perfectionist, authoritarian, bullying and punishing. The underdog is primitive, evasive, excusing and passively sabotaging the demands of the top dog and usually succeeding. The process of integration is achieved when the patient becomes aware of both the top dog and underdog by entering into a dialogue in which he alternately takes the part of both. I believe this exercise would be very beneficial for Gareth to gain insight. As you can see, with each and every case study, the factors of success and failure in both person-centred and Gestalt therapy depend on the exact patient situation, patient variables, therapist factors, and interaction variables. In some of my answers above, I extended on the case study notes for the purpose of the example. Thank you for your time.